Hello. Hola, Soledad. Hello, Liza. Hello, Alan.
Hello
Dear
there.
Sherry, Virginie, where are
Hello.
you?
I'm
Good
here.
morning.
Good morning.
Hello, Virginie.
Hi.
Merci beaucoup for the curriculum. Thank you very much, my dear. Okay, my dear. Well, officially we begin now. We will welcome all our speakers and, of course, all the audience in this 28th online academic session from Collegium Medicorum Theatri. This is wonderful to see you today, the Saturday, 11th July. And we have a very interesting program because we decided that were going to talk about superior laryngeal nerve. But first of all, we shall begin with a tribute to our dear friend and Collegium Medicorum Theatri member, Professor Dr. Marie-Agnès Fauré. Marie-Agnès was a wonderful COMET member, but as you will hear in her curriculum and in the words of Marc Bouchaillet and Virginie Voissart, she was also a great artist and a great human being. So let's begin with some humble words to tribute our dear Marie-Agnès. I miss you, Marie-Agnès, and you know we love you dearly. And the next one, please. Comet honors you, Marie-Agnès, because you were not only a great, lovely lady, but a wonderful artist and a marvelous phoniatrician and medical doctor with this feeling that we all that knew about your activities. Thank you very much, Marie-Agnès, for being a dear Comet member. Next one, please. So I thank very much Virginie because she sent me a curriculum that the Marie Agne wrote some years ago. As we know, she was a phoniatrician and singer. She also had a private practice in Paris, and she attended two different congresses. She was organizing an annual conference, Comet, in Paris, and she was also a very active fellow Comet member. She had wonderful presentations, including one in Europe, many publications, six. She had also three main roles in theater. And after establishing her private practice, she also had presentations, including 21 international. And she also had some publications, 57. And she was performing in different concerts and recitals in France and Germany, 28. And she was also practicing martial arts since 1975. She was a wonderful secretary of the French Society of Phoniatrics and Communication Disorders in France from 1981 to 2001. The next one, please. And in her artistic background, she began playing violin at the age of 9. She participated in the student orchestra of the Belfort Municipal Conservatory, and also she was singing opera in soprano range. She began at age 16. Wonderful voice, Marie Agnès. She studied with the different professors like Marcel Bunlet at the Strasbourg Conservatory and in the Strasbourg Dramatic Artistic Center. She began her medical studies in 1969 in Strasbourg, and then she went to Besançon. Well, also at the same time, and this is wonderful for Marie Agnès, she was taking singing lessons in Paris with Marcel Bonlet, and then after that with Helmut Lips, and she was practicing in Vincennes Vocal Research Center from 1976. She was also taking lessons with Andrea Gouillot in Paris, occasionally since 1980. In her third year of medical school, Marie Agnès won first prize for excellence in singing at the Epinal Artistic Competition. And in August 1974, in Bayreuth International Youth Music Festival in Germany, of course. In the summer 1775 and 76, she was taking masterclass also in Salzburg with Arlene Auger, followed by private lessons in Frankfurt am Main. In April 1975 to October 77, she was also in the acting medical intern service in traumatology, ENT, and audiophonology. Next one, please. And as you see, our dear Marie Agne, she had a wonderful, wonderful uh, background in both in medicine and in art, mainly singing. She won the first prize in advanced level in the singing competition of the Union of Women Musicians in 1976. She was soloist in different theaters like Belfort, in Delmont, in Lyon, Dijon, Artesans, in Lamoureux, in Besançon, in Toulouse. Of course, my French is not so nice, but I am sorry. And she sang different pieces by Bach, Cantata Magnificat, and also she was soloist in King Arthur from Purcell. She was singing also Gloria from Bach, and she sang many pieces from by Vivaldi, by Handel, also the Freischütz from Carl Maria von Weber in 1979. She had her medical thesis in Besançon in 1978 and the phoniatrics qualification in 1979. She had masterclass, as said, with Helmut Lips in Besançon also, and she made different recorders in Radio France from February 1982 to September 1983 during the Besançon and French Committee International Music Festival. She also was in the organization of a masterclass with Arlene Auger. She had summer masterclass with Kathy Berberain in France and soprano soloist in the final concert in 1982. She was established in the private practice since September 1982, and before established, she was making also many concerts with orchestra and recitals with the piano. Next one, please. And I would like to tell you that I met Marie Agne for many, many, many years. I think the first time was in Italy in terms of Caracalla, also in a Comet annual conference. And I really appreciate her knowledge, her experience, and all what she thought. And she spoke to us during all the times that we saw her. The last time I met Marie Agnes, and I was so happy to see her because she was with us in the annual conference in April 24. As you see here, we have some photos, and many of you were joining us in this wonderful Paris annual conference, and we were sharing with Marie Agnes many of her dear comments about art and about Comet and about medicine. Next one, please. So I have some pictures like here. Here's Marie Agne with Katrin Neumann and with our dear Philippe de Joncker. Next one, please. And of course, Virgin is there. And also here, Virgin laughing wonderfully with Marie Agne and Liza also, and Dirk Murbe also, and Lionel Lejeune. It was a wonderful annual conference. Next one, please. And here more photos, and you see here our Marie Agne all the time, like a lovely lady and very handsome person. Next one, please. He sent me some of his thoughts about our dear Marie Agnes, and he asked me to read them. He sends many dear greetings to everybody. He's at the moment in a wonderful lake house that he owns. The next one, please. So these are the words from Marc Bouchaillet. Marie Agnes was preparing for the end of her professional career, but illness abruptly and unexpectedly accelerated this process. I am deeply sad by the loss of a friend and professional colleague of many years. Following in the footsteps of her mentor Guy Cornu, also a dear honorary Comet member. She shared with us the entire history of the emerging field of phonosurgery since the 1970s. She demonstrated her unwavering friendship and trust through her frequent presence at the surgical procedures she observed. Her critical eye sometimes expressed discreetly, but always constructively. She also shared her technical expertise with us through her brilliant demonstration of videolaryngoscopy during our courses with Guy Cornu. She always combined her profound professional knowledge in the field of voice, the foundation of her life, with the human qualities that made her so endearing. She will remain a shining example of what phoniatrics should be in today's world. And here are some photos that Mark wanted to share with you and with her lovely wife also. Many dear greetings to Mark Bouchaillet. The next photos are also sent, next one please, from these wonderful phonosurgery courses. Marie Agne is here with our dear Dick Stasny from Houston, Minoru Hirano from Japan, and Nasser Kotbi from Egypt. This photo was taken during the last of the 10 phonosurgery courses that Guy Cornu and I gave at my clinic between 1980 and 1999. These courses held every 2 years were very well attended, and the last one in 1999 had 240 participants, including 170 from around the world. Thank you, Mark. And the next one, as wonderful here, is our lovely lady, Marie Agne. We kiss you from this world, Marie Agne. The next one. And here are with Minoru, Mark, Bouchaillet, Dick Stasny, and the next one, please. Now is a tribute that our dear, dear Virginie Voissard has prepared for us. Thank you very much, Virginie. Let's play the video. Next one.
Dear colleagues, dear friends, Marie-Agnès became far more than a colleague to me. She became a dear friend for whom I had boundless admiration because of her extraordinary personality. She introduced me to the world of phoniatrics and helped me understand what distinguished phoniatrics from laryngology in the European tradition. She constantly encouraged me to challenge myself and to advocate for a cause that has since become my own, the field of physical and rehabilitation medicine of the aerological tract. This is the first time I have spoken publicly about Marie-Agnès since her passing. Until now, the pain of her loss has been simply too great for me to speak about her. The tribute we pay to her today is based on the many recollection and testimony gathered by Philippe Epron, President of the French Society of Phonetics and Laryngology, and by our colleague Bruno Colombo. Dr. Marie-Agnès IV passed away suddenly on Friday, the 17th of April 2026. Vici d'arte, highlight for art, sings Tosca in the second act of Puccini's opera of the same name. Like Tosca, Marie-Agnès IV devoted her life to the voice, to singing, and to music. Having entered the Conservatory of Belfort, her hometown, as a violin student, she discovered the world of classical singing during a vocal lesson, a discipline she embraced from that moment onward and never left behind. She trained as singer under the renowned Wagnerian soprano Marcel Bunlet, before pursuing further studies at the International Youth Academy in Bayreuth and with Arlen Auger in Salzburg. Also, she considered pursuing a professional musical career. Her deep desire to help others and no dupes, the strong encouragement of our family to choose what they regard as a serious profession led her instead to undertake medical studies. She completed her training in phoniatrics in Besançon under the supervision of Professor Jean-Claude Lafont. She subsequently contributed to development of the university's certificate in phoniatrics, where she lectured on vocal disorders. She also took part in the preparation of articles for the renowned Bulletin d'Audiophonologie of Besançon before continuing her professional career in Paris. A leading figure in French phoniatrics, she also cultivated close and enduring professional relationships with colleagues in Paris. Among them were Dr. Guy Cornu, Dr. Marc Bouchaillet, and Dr. Jean-Blaise Roquignon, whom she had, in fact, first met even before their phoniatric training at masterclass conducted by Helmut Lips. There are also special relationships with Dr. Marie-Christine Danois and Dr. Geneviève Oyer-Martin in Marseille. She was internationally respected, enjoying close friendships with distinguished colleagues including Dr. Minoru Hirano in Japan, Dr. Ron Becken in the United States, Oskar Schindler in Italy, Corey Casanova in Spain, among many others. Her international standing was further reflected in the outstanding success of the Conference of our Collegium Medicum Theatri, which she organized in Paris in 1997, and her contribution to many other courses and scientific meetings. It was also evidenced by the tribute published following her passing by the Spanish Society of Phoniatrics. Her contribution to the investigation and management of voice disorder was multifaceted. As a clinical phoniatrician, she cared for many singers, both classical and non-classical, as well as musicians and actors. With some of them, her relationship grew beyond the purely professional. Jordi Savall, Montserrat Figueras, Laurent Saltiel, and Cathy Berberian were among her friends. She also worked extensively as a voice rehabilitation specialist, placing great emphasis on body awareness and posture. In parallel, she pursued research at the Laboratory for Musical Analysis in Paris, working along Michel Castellengo, Bernard Roubaud, and other collaborators. Although I have no photographs of her rehabilitation sessions, I am fortunate to receive this recollection from her godson, Simon, which I would like to share. He said, "I can still vivid remember our walks along the beach of Brittany, where I had to think about digging my feet into the sand to strengthen the arches of my feet and correct my flat feet, while at the same time carrying myself with regard pose as through the entire playad rested upon my head." Her commitment at the advancement of phoniatrics was also reflected in her long-standing service as secretary of the French Phoniatric Society. Over many years, she played a central role in organizing the Society's annual meetings, as well as numerous educational courses and professional training programs. Her friends and colleagues in the field remember her as a vivid and unforgettable personality, a woman of exceptional sensitivity who never left anyone indifferent. Elegant in both appearance and taste, with a preference of monochrome, fiercely independent, demanding in herself and others, and deeply passionate. She remains throughout her life unwilling to be confined by convention or expectation. Her uncompromising standards, perfectionism, and outstanding expertise in the field of voice inspired many young physicians to pursue a career in phoniatrics, among them Corey Casanova, Natalie Malinchenko, and myself. Then came the tragic accident on 28 May 2000. as she was returning from the Pan-European Voice Conference in Marseille with Ron Bacon. After a long and arduous stay in intensive care, followed by many months of patient rehabilitation, this life-changing event forced her to set aside her greatest passion, singing, and to profoundly reshape her professional concomitants. Yet she never abandoned her patients. She continued to provide clinical consultation and voice rehabilitation, remaining devoted to their care even after retiring from her private practice on Rue Coquillère. She maintained weekly clinical activities at the Saint-Jacques Health Center in Paris until the end. Throughout her remarkable career, she achieved a rare harmony between scientific knowledge and the artistic and spiritual dimension of singing. This union lies at the very heart of the beauty and richness of our specialty, the field of phoniatrics, which today mourns the loss of one of its most distinguished members. Today, the entire phonetic community and all those dedicated to the care and study of the voice bid a final farewell to Dr. Marie-Agnès Faure. Brava, Marie-Agnès. Thank you for all for listening to this tribute.
Thank you, dear Virginie. And I want to say thank you, Marie-Agnès, because your presence was all the time brilliant, and you spread so much good feelings and nice feelings for the art and for the medicine. Thank you, Marie-Agnès, that you came to Paris and we could see you and share with you some moments. And thank you for your whole life and your commitment to the great things in the world. Thank you, Marie-Agnès. And I thank everybody that helped to make this humble and small tribute to Marie-Agnès. I thank very much Bruno and, of course, Hughes, her brother, that at the moment he couldn't be here with us. And I thank you dearly, Virginie, for this great video that you made for us. Thank you. So
Thank
we
you.
keep on with our program, please. And we are going to talk about superior laryngeal nerve diagnosis and treatment. And of course, there are very interesting things about this topic. And it was a very nice idea from our dear Liza Popel. And of course, the next one, please. Just a small reminder about superior laryngeal nerve. And we do know, and we, of course, have daily to deal with all these wonderful structures that we see here. So we shall have in our program, next one please, first of all, the presentation of our dear Shigeru Hirano, that he also sends many dear greetings to Marc Bouchaillet and to Comet family, because he couldn't be with us today. But as we know, he is the son of Minoru, and Minoru was a very dear friend from Marie-Agnès. Shigeru is professor and chair at the Department of Otolaryngology, Head and Neck Surgery in Kyoto Prefectural University of Medicine. He studied Faculty of Medicine in Kyoto, 1986 to 1990. He also made a research fellow at the Division of Head and Neck Surgery in UCLA, and also at the University of Wisconsin-Madison. He is associate professor at the Department of Otolaryngology, Head and Neck Surgery in Kyoto University. He was there from 2005 till 2016. And since 2016, he is professor and chair of the Department of Otolaryngology, Head and Neck Surgery in Kyoto Prefectural University of Medicine. His professional career is a very short one. He has been advisory board in the Japan Society of Otolaryngology, Head and Neck Surgery, president of the Japan Laryngological Society, former president of Japan Society for Head and Neck Surgery, advisory board from Japan Thyroid Society, advisory board also from Japan Association of Endocrine Surgery, He is executive board from Asia Pacific Society of Thyroid Surgery. He is also a corresponding member in the American Laryngology Association and an active member in American Bronchoesophagological Association. He is at the moment in the advisory board of International Association of Phonosurgery and in the Voice Foundation. Of course, he is also a very dear active COMET member. Thank you, Shigeru, and let's enjoy his presentation.
Hello, everybody. I am Shigeru Hirano in Kyoto Prefecture University of Medicine. I'm very happy to be here to share the time with you. I'm talking on the superior laryngeal nerve paralysis treatment with regenerative medicine using basic fibroblast growth factor. I also include recurrent laryngeal nerve paralysis treated by basic FGF as well. Now, vocal paralysis or paralysis causes tension imbalance, which is a big problem because it reduces the tonus of paralyzed or interlaryngeal muscles, which causes atrophy of thyroid muscles, TA muscles, or correct thyroid muscles, CT muscles. The atrophy of the muscle causes different tension between the vocal folds, which causes asymmetric vibration leading to dysphonia. This cannot be treated by voice therapy well, or cannot be treated by thyroplasty even, so we have to regenerate the paralyzed muscle in order to restore the voice in such cases. There are several tools to regenerate muscles or nerves, including stem cells or regulatory factors, including basic fibroblast growth factors or other growth factors. And especially we focused on the basic FGF because it's well known that basic FGF has a variety of functions to regenerate tissues. For example, it's improved the wound healing or it stimulates angiogenesis. We found basic FGF is useful for the regeneration of vocal mucosa in case of scar or atrophy of the vocal. In the meantime, basic FGF has proven to have regenerative effects of the muscles or nerves in other areas. We performed recurrent laryngeal nerve paralysis model of rat experiments to examine the effects of a basic FGF on the regeneration of the muscles and nerves. In this model, recurrent laryngeal nerve was resected unilaterally, and then 1 month later, weekly basic FGF injection into the paralyzed TA muscle was applied 4 times with different doses. At 3 months, assessment was done using muscle fiber, nervine, and acetylcholine receptor analysis. The result shows the muscle fiber were atrophied after the resection of the recurrent laryngeal nerve, but it's improved after the application of basic FGF. We also found MyoD or MCAT heron. They are the markers of the regeneration of the muscles, and they were significantly improved after the basic FGF injection, which indicates the actual regeneration of the muscles. Acetylcholine receptor is the marker of the nerve, and this was also significantly increased after the basic FGF application. Nervine itself was also significantly increased after the basic FGF injection, which shows that basic FGF is useful for the regeneration of the nerve as well as the muscles. Based on these animal studies, we have applied basic FGF intramuscular injection to the paralyzed or paralysis vocal muscles in 8 cases, including 3 cases with CT paralysis, 5 cases with TA paralysis. CD paralysis was occurred by hemothyroidectomy or brain infection or others, and TA paralysis was caused by trauma or intubation or others. Voice therapy was applied for the whole cases, but it didn't show any effects. And some cases underwent thyroplasty, but it didn't work as well. Now we applied basic FGF into the TA muscles or CT muscles under topical anesthesia or local anesthesia. Weekly 4 times injection was done with the dosage of 10 micrograms for one vocal fold muscle. We placed the needle lateral to the vocal mucosa to inject into the TA muscles transorally. And also, we can inject basic FGF into the CT muscle from the neck. It's not so difficult. Assessment was done for the aerodynamic parameters or acoustic parameters, and vibratory property were examined using vocal vibratory amplitude, using the images at the closed phase and maximum open phase of the stroboscopic findings. We also examined laryngeal EMG before and after the injection, and a turn analysis was performed to represent the activity of the muscles. This is a case with the left recurrent laryngeal nerve paralysis and the TA paralysis after thyroidectomy, and thyroplasty type 4 was also done, but there was no effects, and breathy voice in low-pitch phonation was typical. High pitch is okay, but low pitch causes big hoarseness. 4 times injection was basic FGF was done and 3 months after the injection. Low pitch is good as the high pitch. So her voice was improved. This is a case with left superior laryngeal nerve paralysis after thyroidectomy. Prolonged breathy voice was a problem caused by tension imbalance. The vibration is asymmetric. The voice is rough, and 4 times injection was done to the CT muscles. The vibratory pattern is much better and the voice became better. This is another case with superior laryngeal nerve paralysis after thyroidectomy. Her symptom was impossible in high-pitched phonation.
少し長めに楽な声で
Low pitch is relatively okay.
はいじゃあ高めどうですか
She cannot make any high-pitched phonation and voice therapy didn't work well. EMG shows the left CT muscle has less activity as compared to the right CT muscles during phonation. Then we applied basic FGF into the CT muscles Now she can make hyperexponation including falsetto. This is the EMG before and after the injections. The activity of the left CT muscle was significantly increased. Overall, basic FGF injection to paralysis of the vocal showed no change in terms of the intensity, mean flow rate, or subglottal pressures, but jitter MPPQ was significantly improved. And also, Gerber scale was improved. The number of turns in the laryngeal EMG was significantly increased, which means the regeneration of the muscles. Vocal vibratory amplitude was also significantly improved. So these results indicated that basic FGF injection causes regeneration of the muscles, which then leads to the stable vibratory patterns of the vocals. In conclusion, we treated 8 patients by basic FGF intramuscular injection to the vocal paralysis, 5 TA, 3 CT paralysis, and the results shows better vibratory patterns with improved voice. Thank you very much for attention.
Thank you very much, dear Shigeru. And I would like to say hello to Professor Wolfram Seiner. He gets. Also to our dear treasurer, Austin King. Also, I want to say hello to Peter Hulin, to Jacob Lieberman, to our dear Joseph Schlomi-Hertier, to Julian McLachlan, to Katrin Neumann, our president from Münster, annual congress from annual conference from Comet, and our dear honorary member Philippe de Joncker, our dearest Ronald Scherer, also honorary member, and our dear Jacobo, he's going to present now, our dear Ramon Hernandez from Venezuela, our newest member 2026, Natalie Watson, and also our dear Deborah from Greece. So we keep on with our program. Mr. Jacobo Karagama, he's an international renowned laryngologist based at Geese and St. Thomas Hospital, London. Of course, you see all the titles that Jacobo has. He leads the voice, airways, and swallowing and OSA surgery service at Geese and St. Thomas Hospital in London. He is also the founder and course director for London and Manchester phonosurgery course, for laser laryngeal course, and TNO and dysphagia course. Also, he has the course, very interesting, in London of OSA dissection. He's an honorary senior lecturer at King's College University in London. He was the first secretary of the British Laryngological Association. Thank you very much, dear Jacobo, for this wonderful presentation that we are going now to enjoy. Welcome, everybody. Let's enjoy Jacobo's Karagama presentation. Thank you very much, dear Jacobo, for these wonderful presentations. And as you see, dear friends, all the situations that we can deal with in the treatment, and of course, first the diagnosis and then the treatment of this superior laryngeal nerve paralysis is very important. And I think, as Jacobo said, and as we know from the daily practice, that we sometimes do not make the diagnosis exactly. So please prepare your questions. Then when we are ready from this session, we shall ask our dear Jacobo, and we shall write the questions for Shigeru. And now we keep on, please, with the next presentation is we welcome our dear Natalie Watson as new Comet Fellow Member 2026, as you already know, because everybody voted for her. And well, she is a wonderful ENT consultant and specialization in laryngology. Let's hear the self-presentation of Natalie. It's great to have you here, Natalie.
Good morning, good afternoon, good evening, wherever you are in the world. Hello, my name is Natalie Watson, also known as Surgeon Singer on Instagram, and I'm absolutely delighted to be elected to be a member of the COMET, the worldwide community. I'm a consultant ENT surgeon and laryngologist. I work in the NHS in London at Guy's and St Thomas's NHS Foundation Trust, and also privately at Welbeck London, King Edward VII Hospital, Guy's and St Thomas's Specialist Care, Cromwell and HCA London Bridge. I wanted to thank firstly Ryukubu and Peak, who you can see here on the bottom right hand corner, for nominating me to be a member of this wonderful community. Ever since I was cast as Dorothy in The Wizard of Oz when I was 7 years of age, I identified as a singer, and I always had a passion to become a doctor eventually. And to be a doctor for singers was the goal from a very early age. I was in a singing lesson at the age of 14, and my singing teacher suggested that that would be a really good idea, and I just stuck with it. I finished school and was the baker's wife and Into the Woods under the pupillage of Heidi Pegler, one amazing head of singing at my school. And I went from strength to strength at medical school. I met Tom Harris, who introduced me to the British Voice Association and taught me incredible foundations in laryngology. Also, I shadowed neurolaryngologists, both Lucy Hicklin and Marion, fantastic neurologist, who really gave me the passion for neurolaryngology. John Rubin, I met as a very junior medical student and did projects with him as a Foundation Year 2 doctor, which is the second year doctor, and went to Philadelphia, the Voice Sound Foundation, back in 2012. Had incredible teachers throughout my training, including Declan Costello, Ricard Simo, Nick Gibbons, but most amazing mentors are Yukubu and Yukubu Garagama and Elfie Cheverton, who were my mentors in my final training job and fellowship in London. Just a few photographs of me performing in musical theatre shows, in cabarets, in choirs, and as a soloist for weddings and for funerals professionally. And I thought I'd just take you through my week. What do? I do airway, voice, and dysphagia, laryngology, surgery under general anaesthetic. There's a before and after photos. On Tuesdays, I have an all-day clinic with a performance specialist speech and language therapist, Tori Benet, in the morning, and Susan Warner in the afternoon, who also a voice specialist speech language therapist. On Wednesdays, we have an all-day procedure clinic, and occasionally we have peds adult transition clinics for those who have trachees or difficult airways or dysphagia or voice problems. The outpatient procedure clinic is very varied, doing trained to do lots and lots of different injections and biopsies, etc. As you can see, this is the peds to adult transition clinic team with my then fellow Xieng He right in the centre, who's also a member of COMET. Also, some pictures just of some things that we do in the outpatient procedure clinic. On Thursdays and alternate Mondays, I have private practice, and where I see mainly performers referred by many people, but including voice coaches, etc. And we have Fridays at my dysphagia and airway day with specialist speech and language therapist. Work really closely with an MDT, and we have lots of fun outside of work too. We have quite a broad network, but really mainly work with speech and language therapists, voice and dysphagia ones, physiotherapists, vocal rehab coaches, and lots of vocal coaches from different genres. research. I'm very keen on research and have most recently done the investigation of particulate respiratory matter to inform guidance of the safe distancing of performers in a COVID-19 pandemic or perform. We published over 12 papers, Declan Costello and I and the team, and have just won the Faraday Horizon Prize from the Royal Society of Chemistry. I started up the Community ENT group. I was a founding member of the Women in ENT group and host the BLA Connections, a Clear Voice podcast. Also run the ENT Essentials course for over a decade. And The Voice, do lots of voiceovers and the voice of the anatomy.tv and lecture in many places, including the Royal College of Music there and King's College. And I've also done lots of voice workshops for various places, including AOTOS and BAPAM, and on the BAPAM Voice Clinic Forum Committee. Also, I'm a faculty member of Yukubu Karagama's London phonosurgery and laryngology courses. You can see here some prizes that I have won in the last few years, including the Jelf Medal at graduation for all merging my singing and academics, and the British Voices Association Van Lawrence Prize for my work with children and aerosol in the pandemic. My teaching prize is the Rowena Ryan Prize at Paper Knife, as you can see there, and Trust Awards for acting with integrity, and the vinyl, the limited edition vinyl that we managed to create during COVID for Songs for the NHS service. We managed to get number one to which helped raise money for Papa Hoods to distribute around the UK. So finally, my loves are family, first and foremost. My friends, musical theatre is up there. Walks, art, cycling, Pilates, and podcasts. And talking of podcasts, that's us, the producer Heather and myself on our one of our conferences, introducing our BLA Connections, a Clear Voice podcast, which you can find in any of your podcast providers of choice. So thank you for listening. I'm very happy to answer any questions. I am on holiday at the moment, so hopefully I'll be tuning in to talk with you. Thank you.
Thank you very much, dear Natalie, that you join us from your holidays, and we wish you the best for these holidays. And welcome to our Comet family community. And of course, your profile is wonderful because, as you have seen in Collegium Medicorum Theatri, we are scientists, medical and non-medical, and scientists at last, that we are in dealing with artistic voice, diagnosis, treatment, enjoying, and everything. Thank you very much, Natalie. Welcome. And now, dear friends, we keep on with our program, and I would like to remind you about some of our situation of the bylaws, because this is important that we have all clear about what Collegium Medicorum Theatri members need to do, because as you know, you must feel free to ask to the presidency and to the board if you have some special activity, educationally or lecture or speaker or whatever. So you may ask for the sponsor of Comet. This is important because there have been some doubts about that, and that's why it is in the bylaws very clear that the program from all the activities in the name of Comet, of your personal scientific activities that you wish to be sponsored by us, please let us know and feel free to write to us. And the congresses, as you know, are open to the whole community, but the speakers are only Comet members. Sometimes we have special guests in accordance with me, the president, and of course with the president of the Congress. Next one, please. And also, I would like to remind you that we need that you feel that you are obliged to promote the interest of the association as much as possible, of course, to refrain from anything whereby the reputation or the purpose of our association could be damaged. This is not the case, fortunately, but we need to very clearly observe the statutes of the association and the decision of the association organs, because we are, as you know, we are having our General Assembly in November. Of course, it's going to be online, that everybody can come, but you need to be active member. Either fellow or associate, the members are obliged to pay in due time the membership fee and fees in the amount decided by the General Assembly. This is not a big deal, but please, I would like to give the word to Austin. Austin, if you are so kind to tell us about the situation of the treasurer and the fees. Thank you, Austin.
Yeah, can you hear me, Eugenia?
Perfectly.
Okay. The first, congratulate all the presenters today. Very interesting topic and somewhat difficult to treat once you diagnose it. But as far as the status of Comet goes, in our current bank account, we have 17,000 US dollars, which is equivalent of about 14,800 euros. 19 members have paid for this year, 2026. Now we have, of course, quite a few retired members that are not required to pay dues, although we certainly always appreciate contributions. But there still remains a substantial amount of members who have not paid. And it's very easy to do, to go to our website and pay through PayPal. We've had some recent problems with Wise, and I don't know whether that account has been hacked or what type of problem we're having with it. But please do not use the Wise part until we notify you that any problems we have there are straightened out. Just go to PayPal to pay. But otherwise, as Eugenia has said, the requirements are to pay the equivalent of 70 euros annually, which is I think, compared to other societies, a very minimal amount.
Thank you, dear Austin. Thank
And
you.
I would like to say also that even though we have that much money in our account, we still don't have all the bills from all our meetings online. From you, Eugenia, you've been kind of taking the amount and paying it yourself, and still we don't have the bills from you. So I want the membership to know that you've been very good about doing that, but we do need to go ahead and reimburse you.
Thank you very much. And I would like to remind you that the members, the ex-members that are not active, they can renew very easily their activities in Comet by paying the 3 years membership fees. This is administrative, but this is very important. And as Austin said, it's a minimal amount, and of course, we are grateful. Thank you. And in the next one, I want to remind you also that the Comet members are encouraged to give lectures dealing with artistic voice at other congresses. And we love to see Comet name under that because, as you know, we are a very special Comet family community. And to do so under the Comet banner with the authorization from the president. We are a selective group and we are a community, a very special community. And we can only be a Comet member, fellow, or associate by proposals from other two members and that the country agrees with the proposal. So this is very strict, and that is the history of Comet, 56-year-old. And the next one, please. And don't forget that we shall have also the commitment to exchange knowledge and ideas among the members. And so I am very glad that in some slides, Katrin Neumann is going to speak about that. But I want to remind you that we need to be active because exchange knowledge and ideas is wonderful. And also, it is important that we know the work from each of the COMET members to facilitate the referral of a singer and an actor. As we have seen today, the two presentations of Shigeru and Yakubu are very interesting with new ideas, with old methods, but with new modern equipment. So we can also refer patients to our COMET family. And of course, to disseminate scientific and clinical knowledge about artistic voice, because as you know, there are many charlatanery in YouTube and many other societies that are not so scientific. And we in COMET are very strict about that. The next one, please. And of course, I would like to congratulate all the COMET members, beginning with our dear Robert Satalov, Johan Sundberg, Ronald Scherer, that made this 55th annual symposium in the Voice Foundation in Philadelphia wonderful. Congratulations. Next one, please. And now, if you wish, dear Joseph, you want to invite all the COMET community to your wonderful voice symposium in Salzburg. Would you like to speak something, Joseph? Joseph, are you there? Well, dear friends, as you know, this is a traditional voice symposium. Now, this year, in August 21st to 23rd, is going to be in Salzburg, of course. Fit Your Skills. And this is updating voice therapy for ENT, phoniatricians, and voice therapists. And my dear Ronaldo Villazon, as you know, a Mexican singer, he is also invited in this wonderful voice symposium in Salzburg with Joseph Schlomichertz here. Congratulations, Joseph. And as you know, Joseph is also the chief of the Department of Occupational Medicine in this Salzburg festival. And he has talked a lot about this, and we have been there. And thank you very much, Joseph, for the honorary position that you gave to me, because it belongs also to all the Comet family. Next one, please. I want to remind you that we are having this Care of the Artistic Voice Professionals the 5th of September. As you know, this is for everybody. I mean, for all the world population. The idea is that COMET wants to give to the world all the expertise and the knowledge that we have. So don't forget to send me the topics, because we need to organize the program. Next one, please. And of course, now I'm going to give the word to the president of the annual conference 2026, our dear Professor Dr. Katrin Neumann. It's going to be from 15 to 18 October in Münster, Germany. Next one, please. And Katrin, if you want to invite us. Katrin, are you there? Mm-mm. Dear Katrin, I saw you.
Yes,
Dear
I'm here.
Katrin, would you like to speak? Yes.
I'm here. So,
Next
shall I,
one,
sh-
please, Katrina.
shall I share something?
Yes, to invite everybody and to say the
Yeah,
program, if
but
you
then
please.
you should please stop your
Yes, the
sharing.
next one, Karina. Karina, next one. Yes. And the next one, please.
Yeah, what you show now is a bit outdated because we went further. Maybe I
Next one.
say, okay. Do you hear
Karina,
me?
next one. Yes. Here. Yes, Katrin. You may speak, please.
Okay. Ah, okay. I see you. So if you stop sharing, I share my slides.
No, it's okay. You can
Ah,
invite us only.
okay. Okay. Then I have to say, we should gather in Münster on the afternoon of the 15th of October, which is a Thursday. And the plan has changed a little bit because the Traviata performance in Münster Opera has been cancelled. And so we start at 5:30 in the afternoon with a concert in our University of Music Münster, and starting with an introduction by the dean, and then it's in the old city of Münster, and then only 600 meters per Pedis, we go to our welcome dinner thereafter in a nice Italian restaurant. On the next day, we start early, quite early, at 8 o'clock, and with an opening, some greetings and so on, and then with Johann Sundberg's keynote speech, and thereafter many presentations. You have asked me, many of the presenters have asked me, how long will I have to speak? It is between 25 and 20 minutes per person, and exceptionally also 30 minutes. And we will have two workshops, one on the first day by famous singing teacher and singer and speech language pathologist Annette Göres. She is really famous in Germany because she saves the voices of many opera and other singers. And in the evening, we will have our gala dinner at Schloss, at the Castle Wilkinghege, with a wonderful concert of a famous Cuban flamenco guitar player, Reinald Maniero. And he will come to our conference from far away. And on the next day, we start again at 8 o'clock, and the second keynote speech will be given by Matthias Echternach, but many other famous speakers are coming. And in the afternoon, we go by bus to Essen, to the famous Alto Theater, where we attend an opera performance by Korngold, Das Wunder der Heliane. And we have a light dinner in the bus, but served by Michelin star cook and chef Franz Lauter, who's also an artist. And on a Sunday, we are free to have some gathering in the morning and some cultural events. And that's it. Thank you very much. I hope that many of you still register. I will send out the program next week.
Yes, thank you very much, Catherine. And of course, all the information, don't forget to send to Catherine with copy to me, because we are organizing, as the bylaw says, we are organizing all together. But I am sure, due to the great experience of Catherine in organization and of course in her love for Comet, that it will be a wonderful, wonderful annual conference. And I hope everybody can come, because the conferences from the Comet family are really a great experience. We have had all over the world, also in Mexico, and of course Santa Fe, Houston, and Germany, in Berlin, and so on. So I invite everybody, and I urge you to get in touch with Catherine and send the topics so they can organize the program. And of course, I remind you, the General Assembly is 28th November. Please be so kind and save this date. Next one, please. And of course, I want to share with you. I am not so humble, but I want to share with you what Mark says, that he is impressed by the enormous amount of work and its high quality that you accomplish of the head of Comet. What I have to say, it's not only me, it's all the Comet family. So I hope all the members are grateful to you. These are the warm regards from Marc Bouchaillet, that he is this year 90 years old. So thank you very much, Mark. The next one. And enjoy Comet activities. Invite your group and subscribe in our YouTube channel. So we are in this time, 8 years that I have been president. We have had 30, almost 30 online sessions, and also congresses in other groups, and also the Voice Foundation's Comet sessions, and many other activities. So please go to our YouTube channel and enjoy so many interesting topics from our Comet family. And of course, I send you, next one, please. I send you many dear greetings from Mexico. As you know, we are now in football time. So I send you mariachi's song from Mexico. And I thank you very much for this wonderful session. And we shall begin now with light discussion. Thank you very much for your presence. Virginie is already gone, also Julian, but I hope you can stay for the discussion with Jacobo and of course with everybody. Thank you very much. You can make the photo, please. Liza, Natalie's here. Alejandra, hello. Brenda, hello. Jacob, please. And Liza, open your, yes, wonderful pictures, my dear Liza. And Jacob, great to see you here. And so we shall have a picture, Karina, from all us. Okay. And Philippe is also here. Wow. Thank you. So we shall begin, and I have to say that Jacob, our dear Jacob, sent some questions, and I address to you, dear Jacobo, about that the diagnosis in SLN contributes also. That means that the association from SLN contributes also to PCA and of course TA. So Jacobo, what is your experience about this comment from Jacob, and your experience in these very interesting cases that we have?
So as I understand, well, your question, Jacob, is that does the SLN does it innovate, let's say PCA and TA and LCA as well? The answer is yes and no. So no is because each nerve, the superior laryngeal nerve, is a sole innervator for the cricothyroid muscle.
Cricothyroid muscle.
Yeah. So the only muscle that is supplied by the superior laryngeal and the cricothyroid, all the others with the recurrent laryngeal nerve. However, in a situation whereby you have paralysis of any nerve, the adjacent nerve will make an effort to innervate the muscle.
Yeah, we have also dual innervation, which makes it even more complicated.
Yes. So, and the problem with this synkinesis is that it gives a wrong function in that muscle. Instead of abduction, you give adduction, or instead of tensing, again. So you know it doesn't innervate other muscles, but yes, in the case of injury, you have synkinesis and abnormal nerve supply to muscle that they're not supposed to innervate, because wherever there's a vacuum, an intruder will come in. So I hope that answers your question.
I said, first of all, if it's really established, and where is the research papers to show that the superior laryngeal also innervates the posterior cricoarytenoid? I don't know about the thyroarytenoid. That's I never heard before. And I have a problem with that, because when you go high in pitch, you elongate the vocal folds. And and then the thyroerythroid will work to bulk the vocal folds. So I have a problem with the concept because it sounds to me like a contradiction in the function. As you go high in pitch, you elongate the vocal folds, the thyroerythroid will resist it. So when you innervate with the superior laryngeal, the thyroerythroid, I don't understand the rationale behind it. That's why I'm a bit puzzled.
Okay, I'm not sure about if the TA contradict the function of the CT because from the name, the thyroarytenoid, where it starts, started from the arytenoid to the thyroid cartilage, and it's a muscle that actually has a very strange function because if you look at the function of LCA, it actually physically moves the vocal cord adduction and abduction with the PCA as well. But the TA, what it does is when the LCA adducts, but if the LCA does not fully
No, the
congregate,
LCA is not a problem because it works only on the erythroid. So the erythroid rotation medially is a thyroerythroid, that's clear. And the cross intererythroid will bring them together in this dimension. The problem is the thyroerythroid muscle, which will bulk and shorten the vocal fold if you want. And in high pitch, you want to elongate the vocal folds. You see what I mean? So it's almost like a contradiction in function.
Well, right.
Yes,
It's new to me that it bulks. What I know is that it actually it makes it firmer.
Yes,
It's actually tense. Yeah. So it actually tense it rather than bulk it.
Okay.
So, but again, like you said, is there a paper? I think this is just anecdotal opinion we're sharing here.
Okay.
I don't think there is a scientific evidence to show one or other. So
that's
the jury is still open. I think.
Thanks, Jacobo. That's okay for me.
Okay.
Yes, yes, and
Good to see you again, Jacob.
I also think, Jacobo and Jacob and everybody, that there are some really individual situations with all the branches. And of course, we have all, this is one point, that there are individual situations. Of course, we know that this muscle TA or this other muscle CT or whatever have different functions. But as we know in the larynx, this is like some uh, together functions or simultaneous functions that are helping. And the other thing, very important, is also that we cannot forget that the feedback that the brain has with the activity of the muscles in the larynx, of course, through training, mainly professional voice users, mainly classical singers, they can also have some other situations simultaneously to the activity of the muscles. Of course, when we make a diagnosis of a paralysis or paresis, we need, like you show in these wonderful videos, we need to examine very detailed what is happening in the muscles. And of course, in the daily life of, for example, singers, like the cases you show, like Amelita, they had some problems with the superior laryngeal nerve, very, very easy to diagnose. But we cannot forget what Jacob says about thyroarytenoid muscle, but cricothyroid muscles is also very important. So I think it's like a mixture. I don't know if somebody from the audience want to add something. Yes, Ronald? Ron, dear?
In the voice science literature, we separate the function of the vocalis and the lateral TA. The lateral TA has muscle fibers from the muscularis, from the muscle contact, and is kind of an adductory add to the LCA. As you go up in pitch, CT obviously is elongating the vocal folds so that the physical tension increases, but also the vocalis muscle will naturally also increase its contraction, even though it's antagonistic relative to
Mhm.
vocal fold length. The combination of, if you have enough motion so that the vocalis is involved in the motion, you have a combination of tension of elongation and tension of the vocalis, such that it's an extremely efficient way to increase the pitch because you have these added effective tensions.
Yeah, that's fine. That's I understand. But the innervation is different because you're talking about the recurrent working in synergy with the superior one. That's why the diagnosis is so confusing here. So when you take a branch, let's say, and you put the superior laryngeal function into the thyroid, it's you see what I mean. But maybe it's too much there that we don't know in terms of dual innervation, in terms of lateral compression, because I have videos. I wanted to present today my way of thinking about it. I show when you have a good cricothyroid joint function, you can see very nicely how the vocal fold elongate and shorten as we go low in pitch. And then a patient who is only doing it by lateral compression, not changing the length of the vocal fold whatsoever. You see, and that's by itself for me, is when I go for diagnosis, not having EMG is very difficult, and I have sometimes to articulate the cricothyroid joint to replicate a weak cricothyroid joint muscle, and that's for me one of the criteria of diagnosis. But it's only palpation, and we need other ways, and EMG maybe is the friend of palpation. And anyway,
Thank
that's
you,
what.
Jacob.
Yeah, okay.
But we can present that next session if you wish. Just send me, because you sent me that it was interesting and I was
Yeah, but
interested
I
also.
didn't
So
have time to prepare
let's
it.
get in touch.
Okay.
Okay, and I wanted to ask you, Jacobo, and everybody, about the possibility during the surgery, if you could make some EMG, but also in the very fine, not only in the important nerves, but in the very fine nerves, in the other nerves. Could you do that, or
I
was
think
it
there's a
difficult?
question. There's a question there as well about the differential diagnosis. Do you want me to answer that question now?
Yes, please. Yes, please.
So on the chat box, someone asked, what's the differential, or how do you distinguish between the current laryngeal nerve and the superior laryngeal nerve? So the diagnosis will start with the history. First of all, the patient will tell you what the symptoms are. If they tell you that my voice is low, then most likely you're dealing with superior laryngeal nerve palsy. And then you ask them, how did that start? If they said, oh, I've had thyroid surgery, then and then you do a nasal endoscopy, you're going to see if the vocal cord is mobile. If it's not mobile, you're going to see whether there's bowing, which you can see in superior laryngeal nerve palsy. And then if the surgery is in the chest, like thoracic surgery or lung cancer, this is going to be recurrent laryngeal nerve, and the superior laryngeal nerve will be spared. If, however, it is skull-based lesion, such as vagal schwannoma, both the superior and the inferior laryngeal nerve will be affected. So before you even examine the patient from the history, you have your working diagnosis. Then with the examination, you'll be able to tell with the stroboscopy whether the arytenoids are moving or not. It's not always cut clear, but sometimes you may have combination of both. And then the final bit is laryngeal electromyography, which is not available in every center, which is why it's very important that you have your diagnosis based on the history and the laryngoscopy. But in my unit, we have lucky to have the neurophysiologist. So we do laryngeal electromyography testing, the CT, the TA, and then the PCA. And you'll be able to distinguish in most cases which nerve is affected more objectively with laryngeal electromyography.
What about during surgery? Could you also test some other nerves, or you were just doing what you plan? Because it
So
was
some
interesting because there are many things that we are not very sure
Yeah,
about.
so I was asked this question about testing the nerve during surgery. If I get your question clear, say I'm doing say reinnervation or varoplasty, so it's pointless testing the nerve there because you should test the nerve before you take the patient to theater because you want to know whether the nerve is damaged because when you take the patient to theater to do reinnervation, you're going to cut the recurrent laryngeal nerve. So if, however, you're doing like thyroid surgery, yes, you can put an EMG plate on the intubation tube, and you'll be able to identify, if it avoids you or reduce the chances of you damage the recurrent laryngeal nerve. So yes, you can do intraoperative testing if you're doing surgery near the recurrent laryngeal nerve, such as thyroid surgery or anterior cervical discectomy, wherever you're going to come across the nerve. That way, yes, you can do that to protect it. So intraoperatively, if you're doing, say, pharoplasty or injection or renovation, there is no advantage that I know in testing them because it's damaged anyway. So what would you be testing when the nerve is already damaged?
Austin, Catherine, would you like to say something about this important situation that, of course, we are dealing with technical difficulties, first of all, but secondly, with the anatomophysiology of the larynx is not so easy as we know, and the anatomophysiopathology is worse. I don't know if you want to comment something, Catherine, Austin, or Alan, Liza, Soledad.
Yeah, maybe not related to the surgery, but we have several times seen this, and I would like to ask you and to share with you a complete, picture, not a picture, but the sound of a voice of a paralysis. However, you don't see a lot in the movement of the vocal folds, and sometimes I only state in my diagnosis it must be, maybe it has recovered in a way, must have been paralysis, and maybe it has recovered so that I don't see a big difference anymore. Do you know about this situation? So you have the diplophonia, you have all the patterns of paralysis voice.
Yes, and I agree with Jacobo and with you, Catherine, that so sometimes the history tell us a lot about that.
Mhm.
But also what I think is the function of mainly in singers, if you have the details that the singers are telling you, for example, after thyroidectomy or after long surgery. I don't know if you have some cases about that because I have cases, for example, long surgery that well, the patient is a singer, but he cannot sing anymore because of both recurrent and superior are with problems, and so we try to help. But unfortunately, the lung problem was very bad, was a cancer, and the patient died. But the singing was very affected, but it was slowly affected. So I don't know. I think we need to look more about a complete diagnosis with function in singing, and of course also in speaking, because there are so many things that can change all the surroundings of the larynx, and not to have a really well thing. Okay, Ron, before you leave, would you like to say something? Come to Munster. Come to Germany. Yes.
I would love to do that. I can't, but I would love to do that. No, thanks again for a great session here. It's always wonderful. I always get information I share with my students. I teach voice disorders, and there's more disorder to talk about. So there you go. So have a great ending of this, and thanks so much. And
Thank you very much, Ron.
you're
Eh,
just a wonderful president. That's really, really great. So,
Thank you. And
go
well,
ahead.
as you see, I was really very, very happy to hear both presentations, Shigeru and Yakubu, because we need to take care more of the details on the voice diagnosis, but also on the treatment, because Yakubu, what you show us in the neurotinization is wonderful after so many months, and how the voice was recovering. Of course, the this Hashimoto thyroiditis girl, she was a little bit also hoarse. Not only the voice frequency was okay, high, and a female situation, but she was hoarse. And could you do something about this hoarseness of this young person?
So remember I said to you with the glottoplasty, it's normal for the voice to be hoarse at the start. Usually the first 6 months, the voice will be husky. And then after that, the huskiness will disappear. So this was just 4 months post-operatively. So the
Okay.
glottoplasty is the most recommended surgery for transsexuals, and because it gives them almost close to normal feminine voice. So that huskiness will go, but you of course have to warn the patient that it's not always going to be guaranteed. They may have lifelong hoarseness if they have scar, because sometimes when you do the glottoplasty, you try to create scar in the anterior third of the vocal folds. The scar may be exaggerated and may leave the patient with a permanent scar. So sometimes the patient will have to accept that as a complication that could happen.
Thank you, Jacobo. And Austin, do you have some comments about this all this situation? It's very interesting.
Well, the problem sometimes is the diagnosis of superior laryngeal paralysis. It's quite easy from a history of thyroidectomy, but when you have someone come in with the complaints that they can't hit their higher pitches anymore, you see a laryngeal rotation on fiber optic laryngoscopy. You see some numbness when you touch the larynx on that side. The EMG that you do can on the cricothyroid can sometimes not be completely diagnostic. So I think a lot of the problem lays in trying to diagnose the problem accurately.
Yeah, I
And
totally
I
agree
don't
with that. And also you have to bear in mind what is the symptoms that the patient are complaining about, because the injury to the superior nerve is not just the pitch that is affected. You have a slack vocal cord. Some of these patients will have bowing. They may have slightly breathy voice because of the superior nerve also, which is why at times you may have to actually combine the treatment with for medialization in addition to the cricothyroid approximation on these patients. So for male patients, usually superior palsy is not usually a huge complaint because the voice is dropped. Okay, so lots of men go to our surgery just to have their voice dropped by having the relaxation plasty. But it's a female that's when it becomes trouble. Or in professional voice user, because it means you're going to have like a monotone voice. And if you have a monotone voice, then for voice user, it's not good.
and I
Yeah,
yeah, and I was thinking now about the misfunction of superior. For example, it would be interesting to know in spasmodic dysphonia, because there are some spasmodic dysphonia that also has this kind of differences in paresis and things like that. So it's quite complicated. And Liza, do you have something to tell us, Soledad?
To
Yes,
congratulate
Liza. Yes,
Jacobo
Soledad.
for yes, thank you, Eugenia. Just to
Okay.
congratulate Jacobo for the wonderful presentation. Thanks.
Thank you.
Thank you,
Yes,
Catherine. Thank you.
no
Please
questions, but
don't
very grateful for the information.
and
Many,
don't
many.
forget to
Many notes to research.
Yes, I was
Much to learn.
wondering if you could say
Oh, yeah.
something from the singing point of view. Liza, what do
Well,
you think?
people don't, singers don't know about even where the diaphragm is, or often they don't know where the vocal cords are. I'll say, "Where do you think your vocal folds are?" And they'll touch the thyroid gland. So this is for me to know, to have an idea
Yes.
of what they might have. I have a student who's she's very small, maybe 3.5 feet, in a wheelchair, and she's very deformed, and she can only go so far in her pitch raising, and it's a genetic malformation, and so I know I can't push it. That there's something wrong with the nerves, and that's why I assumed it was the either superior laryngeal nerve that was limiting her pitch raising ability, but there's so much else just staying alive. But it got me
Yeah.
thinking about it, how little I know about nerves, and what can be done to make nerves work, and then of course to help how they help keep the muscles intact and strong. So it was fascinating. Thank
Thank
you.
you, Liza. And Jacobo, I wanted to ask you about the number of patients where you have been making these different surgeries, mainly thyroplasty 4 and, of course, the neurotenization.
Yeah, so the neurotization is a revelation for me because for years and years and years, I didn't know what to do with these patients, never even to diagnose them, because you look at that retinoid, it's movement. And as an inexperienced or as a younger laryngologist, I used to not come too close to the vocal cord because I don't want to trigger any coughing or reflex. So I miss the atrophy that you see on the vocal fold, isolated ones. But now I'm seeing a lot of them. I've done about 5 now. For one of the patients is bilateral TA paresis. The adenosine is moving fine. Uh, I did injection medialization in bilateral. It didn't work. I had a patient in the past. I did thyroplasty for this kind of cases. The patient didn't get any good results. But every single one of the neurotization that I did, they never looked back. Um, because I think the nerve and then the muscle, the combined technique, putting the nerve and then another nerve with the muscle, does serve the purpose on this. So the more I look for these cases, the more I see them. And they're there, those cases.
Yes, that is very, very important to look for that.
Yeah.
Well, Austin, did you have some comment?
No, I just thought it was a good presentation, and I think this shows the quality of the Comet meetings.
Yes,
Eugenia,
Jacobo,
you
your
mentioned,
work is wonderful.
Eugenia, you touched on a very important topic, spasmodic dysphonia, affecting different parts of the larynx. Because I've seen cases with singers' dystonia. I've had a couple of patients actually. Speaking voice is fine, but singing, they have spasmodic dysphonia when they try to sing. I know if I say I'm going to sing now, my voice will be like, got severe dystonia, but that's just because I cannot sing. This patient, he was a good singer, developed that. So I'm giving this patient Botox injection, and she's back to singing. And then 3 months later, the voice deteriorates, speaking voice is fine, and Botox injection, back to singing again. So there are patients that there are also patients that have isolated cracothyroid spasmodic dysphonia. The voice will be very jumpy, like the one they do up and low pitch of voice. So these cases are there. And I think it would be interesting, maybe one of the sessions, maybe if you have some speakers, obviously I'm happy to share my case with the singers dystonia, but there may be lots of other colleagues out there who are seeing these patients that we can probably have like a discussion forum, like a panel on it.
Yeah. Well, I enjoy very, very much your presentation, Jacobo. I thank you very much because it is so important that you have the possibility to show the cases before the surgery, after the surgery, and with so many months that you have this follow up for the patients. It's great because sometimes the patients are not so easy to follow up, and this is a pity because we don't have the feedback from the results. And I am very happy that you could show that to us. And I wish you come to Münster, Germany, in October. It's going to be very good and very fine.
Yeah, I would have loved to. Sorry, I would have loved to. On another meeting. That's
So
nice.
Austin, Liza, and me, we are coming. Soledad, she says perhaps she's swimming from Argentina. But Austin, Liza, and me, we are coming, Jacobo, by sure. And it's going to be great. You have
I'm
to come.
sure.
So please take these 3 days and come to Münster, Germany. And this is my last annual conference, is it, Austin? My last as president, of course. As Comet member, I come all the time. But anyway, thank you very much for this great presentation. And it opens a very wide area that we need to work more and more. And I think what Austin says, comet level discussion is very interesting. Don't you think so? Okay. Well, I see you soon. And please, Jacobo, if you like to send me the topic for 5th of September, also Soledad, please, and Liza. Remember, it's for everybody. And of course, Austin. Austin has already said yes. Because we need to say to the world in a colloquial way what artistic voice is.
Did
Okay?
you receive my proposal, or I just maybe sent a title and we need
No,
more?
you send the title, but
I need a proposal. Okay, will do.
yes, please,
I'll
because
take
I
care of
need to organize the program for September.
that. Okay.
Okay,
I'll see what
Soledad,
that
you are
Thank
in
you.
TikTok, TikTok.
is.
Thank you very much, Jacobo. Many dear greetings to
Thank
your
you.
family,
Thank you.
and please take care. And I wish you to come to Münster. It's only 3 days,
Thank you.
and
Thank
you are
you.
very close. Austin and me, we are very far away.
I'll,
Also, Liza is very far away.
Mhm.
I will be on your side of the world. That's why I'm gonna be. I'm in LA at that time, so
Oh,
completely.
Oh, in October,
So
are you going abroad?
yes, that's the reason. Yeah, I'm in North America, so
I'll miss you.
Okay.
we're gonna cross each other. Yeah.
Well, thank you very
Okay.
much to everybody, and
Thank
I'll see
you.
you on September.
Thank you.
Austin, we
Bye-bye.
see each other tomorrow, okay?
Thank
Kisses
you.
to everybody.
Bye.
Thank you. Bye bye.
Bye.